Thank you.
Oh, thank you so much, Matt. That's amazing. Thank you.
You're welcome. Thank you for inviting me.
We're going to move now to Claire and Devon from the University of the Fraser Valley in Western Canada. Are you with us, Claire and Devon?
Yes, I am here, and Devon is also here somewhere.
That's great.
Too many
Take
squares.
it away. Introduce yourselves and take it away.
Thank you.
Okay.
Devon, are you good?
I think I am. Are you able to hear me?
Yes,
Yes.
we can hear you.
Oh, good. Okay.
And see you.
All right. If I wasn't, then I don't know how to fix that. I'm just trying to get my presentation up here. Perfect. Okay. Is it visible? Just before I get too excited.
Yeah, you're good.
Oh, good. Okay. Good morning, ASYL. Thank you so much for inviting myself and Claire. My name is Devon McLellan. I am an assistant professor at the University of the Fraser Valley in our Bachelor of Science and Nursing program. And I'm joining you from Chilliwack on Stolotimuc, the land of the people of the river. I would like to, before I get started, acknowledge my position as a settler and an immigrant, and just say how grateful I am for the opportunity to live, work, and learn on this beautiful land, and thank the Stolo people for their stewardship of this territory. So I'm here to tell you a bit about a shift I made in the pharmacotherapeutics course that I teach towards application-based assessments. Before I get into the changes that I've made, I would like to give you a little bit of context about this course. It is a 2-credit class taken in semester 1, when the majority of the students are simultaneously taking their first of 2 anatomy and physiology courses, and they don't start pathophysiology until semester 3. I've had some very kind students who have now completed their first and second clinical rotations come and let me know that not a whole lot of information was retained from this class into the clinical setting. And during our semester meetings, I have garnered some informal feedback from my colleagues who teach clinical in semester 2. And they also reported the same, unsurprising, that not a lot of information was brought into the clinical setting. And the biggest struggle that they mentioned to me was the struggle in applying that knowledge to specific patient settings. So this is the evaluation breakdown that was a part of the course when I inherited it. The assessments were mostly multiple choice with some short answer, and that is great for a select kind of student, but for those that maybe don't test as well, this is a bit of a struggle.
Thanks, Devon. I'll just quickly introduce myself. I'm Claire Hay, and I work in our Teaching and Learning Center at UFE as a learning specialist for curriculum and assessment. And Devon reached out to me early in the summer to work alongside her in this reimagination of her assessments. So when we look at that original evaluation scheme, there are a lot of limitations hidden in there. It really emphasizes theoretical knowledge. There is a limited connection to practical skills and real-world contexts that both the students and instructors in clinical have noted. We know that stress and test anxiety impair performance, and that those settings do not necessarily reflect real learning, what the students actually know and are able to do. And an evaluation scheme that is centered essentially on testing creates many challenges from equity and accessibility perspective. So thinking about how we might improve or reimagine assessments with those issues in mind. Testing is that single snapshot in time. We're not really getting a sense of that long-term retention. And having talked with Devon about this course, the retention piece is key. So how can we build that into assessments? And also very little opportunity for instructor feedback that really can support student growth. So there's lots of limitations in there. This, of course, is not limited to the healthcare field and to health education. It, of course, crosses around the different disciplines. Next slide, please, Devon. So the process of redesign was very much a collaborative process, and I would encourage any of you who are on the call who have not yet worked with your teaching and learning centers to reach out. That idea of collaboration from someone who is maybe more versed in pedagogy together with yourselves as disciplinary experts is powerful. So this was a very much a collaborative process. It allowed for some iterative assessment redesign. So there were many snapshots, many points where we got together, we talked about the things that Devon valued, her goals, we reimagined, Devon revised, we chatted again. So over the course of the summer, and I've lost track of the number of times we connected, but we've created something that Devon will share that hopefully meets the goals that she had in mind. And we also see this as evolving. So now that the course has happened, the work isn't done. So the student feedback that and instructor reflection that Devon will share is now opening the door for the next iteration of revision. So back to you, Devon.
Thank you so much. I am not surprised that you lost track of time because I think I bothered you incessantly. So my goals with updating this course were to make it mimic the clinical setting as close as possible, specifically the action and process around giving medications, moving away from that rote memorization to application. All of the assessments have reflective aspects to start building that self-reflection as a reflex, which is a fundamental skill in nursing practice. This also allowed the course to align with my personal teaching philosophy. I so value the experiential learning aspect of nursing and want to incorporate it wherever possible, especially in the classroom. The assessments in this course are laddered on each other, and while the students are still being taught about drugs and drug classes, we are also starting to build the foundation of some of the intangible skills like critical thinking, problem solving, that professional communication and self-reflection that are all going to play a very important role in their professional skill set as nurses. This is the new evaluation scheme. As you can see, a large chunk of their overall grade now comes from assignments rather than testing. The final exam has also been changed from what was almost entirely multiple choice to entirely application-based case studies, where they are provided drug information like they do in the clinical setting, and then they apply it in the case studies. And we do a practice run. That's what the formative case studies are. It's just a completion mark, and we do them one together in class, and then they have time to work on it, and then we talk through it as a group. The first assignment is about credible sources. The second is the creation of a drug card for a first-year nursing student, and the third is the creation of a drug resource for a patient. And what underpins all of these assignments is my experience in teaching various levels of nursing in our nursing program and my own clinical practice. I am still a practicing nurse in 2 different emergency departments. And while I feel like I know a fair amount about a lot of different medications, I still look things up all the time. It is simply the safest thing to do in practice. We're only human. We can't know everything. And patient safety is always our top priority. Students are also always going to be giving medications that they've never given before. That's part of the learning process. So rather than having this unreasonable goal of know everything about every medication and recite it to me, I would rather than be able to read some notes and actually understand what they're reading and apply it. As we all know, I'm sure, nursing and medicine is always evolving. What was best practice 5-10 years ago has changed. And so by asking the students to, rather than memorize drug information and instead look it up and find current relevant data, we're helping them build those steps for career longevity as well. The first assignment focusing on credible sources for information about drugs, but I'd like to focus your attention there on what I think is most important part, which is the rationale that they had to provide for me to show how those resources were credible. This is something we discussed in class that they then applied to the assignment. The second assignment was to create a drug card for the use in the clinical setting. They were assigned a drug from a list of the 40 most common that myself and other colleagues have seen. We did an example in class, and then now they have a pool of 40 drug cards that I have given back to them. 41, because we did one in class. The second piece on the right-hand side of the screen there is the fourth part of the assignment, which is to provide peer feedback. So they traded with a peer, evaluated it, and then gave that feedback back to the other person, and they were able to make edits prior to their submission. The third assignment was to create another drug resource, but this time with the audience of a patient, specifically an older adult. And they were asked to take into account any sensory deficits that an older person might experience to accommodate for this. All of these three assignments have reflective questions at the end. These are the reflective questions from assignment 2, which I initially added to help create meaning and encourage buy-in from students and to develop those intangible skills that I mentioned at the beginning. Here I have some student feedback, which I took anonymously from those reflective questions with permission, about their experience giving and receiving feedback. To me, the first point here was so important because it caught almost all of the errors. So when I looked at their original draft versus their final submission, they were almost 100% correct, which of course did wonders for everybody's grade as well. Strengthening reflection and collaboration was so great to see that some of these students were acknowledging those intangible skills. And I really loved this comment about a mind that works differently from your own. I have to imagine that all of us have had that experience and know what a gift it is to work with someone who thinks differently than you do. And I was so grateful to have students acknowledge that. The final point of feedback stating that they developed their critical thinking. Just reading that, I could have wept for joy when I was marking these assignments. It was what a gift. This question was about assignment 3. How did it feel translating medical knowledge for a patient? And many of the comments that I received focused on the rewarding aspects of providing accessible patient information and how much more confident students felt in their own knowledge after teaching. And I can definitely relate to that after teaching this course. I was so thrilled that students generally across almost all of the assignments were acknowledging the huge role that we play in supporting patient autonomy and trust. And these comments have just been so meaningful to me reading the assignments, thinking about watching a student think about holistic person-centered care was just such a treat. I would also love to share some very candid feedback, which made me actually laugh out loud while marking. I'm sure many of you know how rare this is. This student said that it was the least miserable university assignment I've ever had. So I think that is high praise indeed. Going through this process has also involved a fair amount of reflection and growth from me, not just from the students. Making these big changes to a course felt very daunting and was definitely a lesson in trusting myself and my experience, both as a nurse and as an instructor. And I still feel very new to both of those, but it's also pushed me to grow professionally and personally, of course. Creating these assignments is something that's very much not in my wheelhouse. It's something I've never done before and certainly would not have been able to do without Claire's support and knowledge in this process. But the thing that surprised me the most was how meaningful I found the reflective questions. I initially included them in hopes of developing some buy-in and, increased understanding from students, but it has been so rewarding and so meaningful to me reading how students feel about these assignments in this kind of informal feedback. Thank you so much for having me here or virtually here. we have my email and Claire's email if you would like to contact us with any questions, but we have some time for questions as well.
Thank you, Devon and Claire, very much. If anyone has any questions, please put them in the chat. I just had a couple of ahas while you were presenting that I wanted to share. First, I think you've really consolidated a theme that we're sounding, I think, today, and that is that the closer we get to mimicking, I think you said the actual clinical setting, the better. And I think that that's come through a few times today, and again with your presentation. I think, we shouldn't underestimate the value of showing students the reward. What you said about rewarding, it was the students found the work rewarding. I forget your exact words, but many times in the last few years that I've spoken to nurses, practicing nurses, and the erosion of the reward in the work somehow, there seems to be something happening, not that I know anything about it, but so for these young people and maybe not so young too, that are in your program, what a great thing that you're showing them, leading them to the reward of the nursing profession. I think you should be complimented. And I guess my only criticism at all is you keep referring to intangible skills. I think what you've done is show us that actually those skills that you listed, critical thinking skills, problem solving, I think there were 4 of them, you're making them not intangible at all. You're making them quite tangible and showing the evidence of them. So, and I think that's what we are all working towards when we do alternative assessment, is making those intangible things tangible. And I thought you should give yourself credit for making them tangible. So bravo. Thank you so much.
Yes,
We're going
seeing
to
students say that they felt proud of themselves about the journey of the assignment rather than the destination of getting a grade was what a treat that was.
Yeah. Makes going to work more fun. For
Absolutely.
sure. We're going to move on. Tracy, thank you for the references too.
Yes.
And we, of course, are taping all of this.